Hello, I'm Dr. Dennis McKenna, as always joined by Fred Venditti, Dr. Fred Venditti, our Hospital System General Director. Today is Thursday, October 28th, giving you the update from Albany Med. And Fred, we got a lot to cover.
We do.
So let's jump right into the first graph. Here's New York State people in the hospital with COVID. We are under 2,000 for the first time in a while. Yeah.
Yes.
1,996. Next graph, here's the capital region. This one is also plateauing in the 150 to 170 range. Today, 172.
That's right, Dennis.
Regional call today. What did you learn?
Basically, we're flat. Everybody's flat in terms of the cases they're seeing and the number of people in-house.
All right, for those who want a sort of specific look into the medical center, here's the next graph. This is admissions and discharges at the medical center. You can see here, at least this week, we're trying to take a more narrow view rather than the 18-month of the pandemic,
That's right.
Just the last couple months, and you can see visually what's happening there. And then last graph here, here's the morning census at Albany Med here today on Thursday. Currently 42 in the hospital. Here's your breakdown. 40 adult, 2 children. Of the 42, 8 are no longer infectious. But of those 42, 11 are in the ICU and 4 are on ventilators. And the trend continues to be the same for those that are admitted in the last week, overwhelmingly unvaccinated.
That's right, Dennis.
Fred, another graph we're going to talk about here in a second is going to be talking about admissions to the hospital based on your vaccine status. But variants, let's talk about variants.
That's right.
And let's pop open that other graph here. This is the one you showed last week.
That's right, Dennis. So it's been updated for this week, and it really shows the same thing. If you look at the right-hand side, 100% of variants identified in New York State are the Delta variant.
So this weekend there was some talk, I didn't hear it, you did, about something called Delta Plus. What is Delta Plus?
So Delta Plus, Dennis, is a slight variation on the spike protein that is prevalent in the UK. Doesn't really seem to change transmission all that much or how sick people get, and is still sensitive to the vaccine. So it's a slight modification that probably isn't going to alter anything clinically.
So is Delta Plus a new variant, or it's the same one, just changing a little bit?
So, Dennis, I'm not a virologist, but I think it's called Delta Plus because it is a substrain of that variant.
Okay.
And so, Delta Plus.
Delta Plus. Bottom line is the graph this week looks a lot like last week. In this region, what we're seeing is Delta.
That's right.
And as you talked about last week, the vaccine works against Delta.
That's right. It absolutely does.
Very good. Fred, now let's talk about these graphs here. So we'll pop them up. I actually have to hold one here just to get my colors oriented here. The first one here is new daily cases over time. And on your horizontal axis, you go back to May through October. And then on the vertical axis, we're looking at cases per 100,000. And Fred, there's really 2 lines to pay attention to. The first one is the red one, and the second one is the blue one. And what do they show us?
So, Dennis, the blue line are those individuals who are unvaccinated.
Okay.
And so you can see starting somewhere in the summer, a pretty steep rise in the number of folks who contracted COVID.
Okay.
The red line are the vaccinated people.
Okay.
And you can see there's a big difference, about a 10-fold difference, and a rise at the same time period, but not nearly as much as the unvaccinated.
And then for those that are paying attention to this, by the way, this population is adult 18 or older.
Correct.
There's also a black line, and the metric that they're measuring there would be on the right-hand side. That's that vertical column, and that is the estimated vaccine effectiveness. And that one, for new daily cases, would estimate it to be around 80%.
That's right.
And that's the difference between the unvaccinated and the vaccinated as far as cases.
That's right, Dennis.
And then the other graph, which will pop up right now, is essentially the same information, only it's looking at hospitalizations. So not just whether or not you diagnosed with COVID, but whether or not you landed in the hospital. And visually, they look the same.
They do, Dennis, although I'd point out the unvaccinated
Right.
population, it's an even flatter
Right.
change over the summer into the fall than the positive cases.
And the result of that is that if you look at the vaccine effectiveness, this one's now closer to 95%.
That's right, Dennis.
Yeah, right.
So the vaccine's even better at keeping you out of the hospital.
A point we've made a couple times, but worth making again. If you have a breakthrough case, if you are vaccinated and ultimately are diagnosed with COVID, we know what occurs. The first graph would suggest it's 80% effective at keeping you from getting cases, but it's even more effective about keeping you out of the hospital.
That's right.
All right, very good. So I like those graphs.
The state's website, go to the state's website, the COVID-19 data It's a little tab for that.
Right.
It's been updated. It's really good. Good information.
Let's also talk, is there any flu cases in the hospital right now?
No flu in the hospital yet, Dennis.
Okay. Last year we had like 3 cases all winter.
I
It's
know. It was
unbelievable.
amazing.
All right, let's close out, talk a little bit more about vaccines. We also know that Pfizer is going to be approved for children between the ages of, I think it's 5 and 11.
5 to 11.
And we expect that in early November to kick off.
So the expectation is that the CDC is going to release that approval this week, and then there would be availability next week of the drug.
So one of the questions I'm getting is, if I have a child and I'm part of the Albany Med pediatric practice, will I be able to get my child vaccinated here?
And the answer to that question, Dennis, is yes.
Great.
So the Gen Peds group is going to be running clinics on Saturdays.
Okay.
They've begun to organize that and select the dates. So when that gets firmed up, we'll share that with you. But they're going to be providing to children 5 to 11 the Pfizer vaccine here on the campus at 391 Myrtle.
Okay, and we know there are some people who watch these videos who may have a pediatrician who's not part of the Albany Med practice, and we know there's going to be multiple practices in the area
That's
that can
right.
do this, and we'll be sure that information is on capitalregionvax.org or the other sites that have that.
The feds have arranged for 25,000 pediatrician offices
Right.
to be able to deliver this vaccine. So there should be a lot of availability.
Right. Fred, to talk about the staffing issue for a second, we know, of course, that one of the things in the last month that helped us from the staffing standpoint is the governor's executive order, which had in there a couple of things that we benefited from, as far as the ability to have nurses come in from out of state, paramedics working in the emergency department, et cetera. Any update on the executive order?
So the executive order was supposed to expire at midnight last night,
Okay.
but the governor renewed it. So it's renewed for another 30 days. That takes us to November 26th. So
Good.
thank you, Governor Hochul, for
Yeah,
doing that.
for sure.
It's been very helpful to us.
It sure has, and we certainly were glad to have heard that it was extended, and perhaps it might even need to be extended after that too.
Dennis, I think it's going to need to be extended
Right.
a couple of times beyond the end of November.
All right, very good. Let's take a couple minutes and reflect on some members of our workforce that we want to give a shout out to, appreciate. This is your week, as we say.
That's right.
First of all, it was Pastoral Care Week. At the CCLM meeting this week, we had Chaplain Marvel come. I call him Captain Marvel.
Right.
He's in the military.
That's right.
And he did a blessing of the hands. It was really nice.
It was terrific, and that is starting to spread out into the rest of the organization. Lots of
Right.
people are asking for it. If you haven't and you want to have blessing in the hands in your unit, reach out to Jake. He'll be more than happy to come.
Absolutely. And Fred, we've talked about how we are different than a hospital. We're an academic medical center.
That's
We
right.
do clinical care, we do education, we do research. Interestingly, people may not know, we have something called a CPE program. So that's Clinical Pastoral Education Program, where it's a year-long program, and this is where people will come in and learn how to be pastoral care in hospital settings.
That's right.
It's a great program.
Think of the residency. It's
Right.
like a training program, just like we train doctors and nurses and
Right.
a whole host of other people. We train chaplains.
Very good. It is a healthcare facilities week, and so there's 3 that make up that. It's facilities and maintenance, clinical engineering, and environmental health and safety. Fred, jump on that one.
So they're a terrific group. They're constantly here, 24/7. They're the people that come in when there's, a snowstorm that we
Right.
need to get plowed out from under, or there's a leaking roof, or a toilet doesn't work. You name it. They make sure that all the facilities work the way they're supposed to work for our patients and our employees.
I can think of no less than a dozen times in the last year with COVID where something needed to be built overnight, a negative pressure room or a testing location, and that team worked through the night to make it happen.
And they're also making sure that we're doing things safely.
Safely.
Both for our patients and for our employees.
Right. Very good. So congratulations to them. And then lastly, it's Respiratory Care Week.
Yes.
So respiratory care, for those that don't know.
So there are respiratory therapists. They are absolutely important, particularly in COVID.
Right.
Think about that, Dennis.
Ventilators.
That's a respiratory disease.
Right.
Ventilators, you got it. They, again, work tirelessly 24/7 in our ICUs, in the emergency room, throughout the whole hospital. They've been a group, Dennis, that's been particularly stressed in
Yes.
COVID, and I think they deserve a special shout out. They've done a tremendous job, and we really appreciate that.
We do, and they work with the littlest of our patients
That's right.
in the intensive care unit. They work obviously in our trauma bays. They work all over the hospital. A
Yes.
very talented professional group.
Yes, thank you for your hard work.
Fred, it's open enrollment, and I think it started yesterday, and this is for those, obviously, annually who have to renew their health benefits.
That's right. It goes from yesterday through the 12th, which I think is 2 weeks from tomorrow.
Okay. Any changes to the plan?
So one non-change,
Right.
premiums for the health benefits have not changed.
Excellent.
So that's a positive. And some of the co-pays, some of those
Right.
costs have also been reduced, particularly in the Tier 1
Right.
grouping.
Very
So
good. Very
it's
good.
really, really positive.
And obviously, we thank our folks in HR and finance who work on that and to make that happen.
Yes.
For sure. Last night, Fred, let's show a video here. Several members of our team, actually this 2 nights ago, were very fortunate to go, and as Albany Med was recognized as a champion by an agency called NYSID, which is the New York State Industries for the Disabled. NYSID has many missions that includes finding individuals with disabilities meaningful employment all throughout New York State. A wonderful group led by Maureen O'Brien. Fred, you will remember back in March of 2020 when we were trying to get face shields.
They made them for us.
They made them
Dennis.
for us.
They did. I think we talked about them on our video.
We sure did. We
Yes,
sure did.
Absolutely.
And as I said when we were getting the award, what's really remarkable is that while we were very appropriately on this campus healthcare providers were being recognized for what we were doing to protect the community,
That's right.
they were protecting us by
That's right.
making these face shields for us. So we got this award, and then one of the reasons we got it is because they recognized the efforts that this campus did in reaching back and helping to vaccinate that population. So it was really a great night, and so we thank them very much for that.
Congratulations.
Who was our Eye Care Award winner this month?
Dr. Jason Mousakis.
That's right. That's right.
Jason is the interim chair of the Department of ENT,
That's right.
otolaryngology, and really a tremendous clinician, and actually a really good person.
He's a fabulous leader. He's a fabulous leader. Otolaryngology is a new department in the college. It's a new service in the hospital as far
That's
as
right.
having that status. Jason's obviously been part of that. Runs a fabulous department, and they hit on all cylinders of our mission: clinical care, education, research.
yeah.
And obviously, as it always is the case, people wrote about him in a way that was very complimentary. His parents were there.
Yes,
Which is great.
and his wife.
His wife was there,
Yeah.
Amy. So congratulations. to Doc.
Congratulations, Jason.
Which leads us to the last topic, which is Employee of the Year. We're looking for nominations, and obviously if you work with somebody and you'd like to recommend them, you can submit that nomination. That's on the internet
Right,
page.
forms are on the internet, the
Very
CARES page.
And we usually announce that in January, so got to get those in soon.
That's right.
So we covered a lot. Anything else we want to talk about today?
Boy, Dennis, I think we covered it all.
Covered it all. All right, we're rolling into the weekend, and it's maybe going to be rainy. It's going to be. I have a cross-country meet on Saturday to go watch, so we'll see.
Bring an umbrella.
Bring an umbrella. Very good. But they'll still run. If you run fast, then the rain doesn't hit you.
It follows you.
To those members of our workforce who are here all weekend working, day, night, 24/7, we thank you very much, now more than ever.
That's right.
And we'll be back again next week. We ask that you once again take care of yourself, take care of each other, and we'll see you next week.